Most of the time, actually, the Barth patient might see a cardiologist. In fact, that's how I was involved. The cardiologist had asked the neurologist to see the patient. Well, the heart is a muscle, and neurologists are generally involved when there's issues with muscle weakness, skeletal muscle, or low muscle tone. That's how it usually ties in. We are collecting neurological data, and I expect that it will be useful in terms of several things. One is as a help in recognizing some of the neurological aspects of Barth syndrome, so it can make it easier for other clinicians to recognize this disorder, which frequently is thought to be missed for several years. Sometimes, in fact, the diagnosis is made because it's a family member, and then a family member who's never been diagnosed is diagnosed as a result because nobody ever recognized it, even though they may have seen other clinicians, both cardiologists and neurologists. It's actually been fascinating for me to be able to, I'm thankful that the foundation invited me to participate, that it gives me a broader view of the disorder, be it by seeing many patients in a short period of time who have various neurological issues, so that we can have a better handle on it. What really was the most important thing is that there's actually quite a bit of variation in how the children with Barth are affected, in terms of weakness, in terms of fatigue, and those kind of things. It's quite variable. Network is very useful for one as being a support network for any family and patients who have the diagnosis. And secondly, I think that the goal of everyone is to find a solution, a cure to make the kids better, and that way they can be always upfront on all the latest of what's going on, as well as help in the whole process by participating in the activities of the foundation. For me, it's been fascinating to see how a group of parents have come together and put a foundation together to try to help the children, where the parents really try to push the scientists and the doctors to try to figure out what's going on so that perhaps one day we can find a cure.